So we know the virus doesn't discriminate, but we also know that communities are not experiencing this pandemic the same.
The uneven effects of COVID-19 on minority groups has been described by CDPHE as one of the most profound lessons learned.
It's also crucial to remember that no matter your race or your background, we are all in this together.
Data the state started reporting earlier this month shows Hispanics account for 35% of all cases, though they make up less than 22% of Colorado's population. African Americans made up 7.6% of cases and less than 4% of the population. The Centers for Disease Control and Prevention's website lists a few factors that influence the health of minority groups. They say members of racial or ethnic minority groups may be more likely to live in densely populated areas, making it difficult to practice social distancing. The CDC also shows minorities are overrepresented in low-income essential industries and are thus more likely to be exposed to the virus. And these particular groups face barriers to getting health care, like a lack of health insurance, which could make them especially vulnerable during an outbreak.
But it's also essential that the results are acknowledged. Just collecting them, putting them in a box, and not doing anything about it doesn't really help the communities affected.
In Wednesday's town hall, hosted by State House Democrats, the ACLU's Denise Mayas says minority groups should also have free testing and treatment. Advocates are also calling for a more equal allocation of relief money to minorities, as well as help with their rent. Jordan Chavez, 9 News.